So obviously Cheshire and Merseyside, along with the rest of the Northwest, was particularly badly hit by the COVID pandemic. And when we were looking at our recovery, our way out of the last wave, it became apparent that workforce was one of our key restraints within the bowel cancer screening programme. And looking at that in more detail, the fact that bowel scope has stopped means that they're going to reduce the age for the bowel cancer screening programme, and they're probably also going to reduce the FIT score, i.e. increase the sensitivity of the test itself, which will mean that not only are more patients eligible for the test, but more patients will be testing positive. And we calculated that we would probably need to have double the number of colonoscopies and hence double the number of screeners accredited over the next 5 years. So having decided that we needed an accelerated programme to get a good number of people accredited across the 3 schemes that we have in Cheshire and Merseyside, there are 3 bowel cancer screening programmes across the region: Cheshire, Merseyside and North Liverpool. And we brought together a lot of people involved in this, really. So obviously we needed each of the 3 programmes to be involved, particularly the programme directors. They needed to identify potential new screeners. We needed help from Health Education England and the Bowel Cancer Screening Programme, obviously from the network itself, and from the JAG, really. So with the network, we developed a programme where we would customise what had previously been run as the pre-accreditation bowel cancer screening course, but that we would try and run it in a more sort of customised way and in a more socially distanced way. So we had one element that would be delivered by a webinar, and only one element would be delivered with face-to-face teaching. So the various units identified their trainers, and I think we eventually ended up looking at about 15 different people who were interested in becoming screeners. It was a joint effort with some of the other programmes around the country. So myself and John Anderson, who's from Gloucester and Cheltenham, we put together a webinar that we ran for 5 or 6 candidates, and since then we've actually recorded part of that programme, so that it's now available online as a resource for the rest of the country. Once we'd had those discussions, we then set up either a half a day or a full day of actual face-to-face teaching, where we went out and ensured that all our trainees were up to scratch. The idea being that they would pass the MCQ from what they'd learnt on the webinars, and then a combination of the webinar and the face-to-face teaching, that they wouldn't face themselves, because doing the bowel cancer screening assessment is very much like doing a driving test. It's mirrors, signals, manoeuvre. What you don't want to do is fail yourself. You just need to make sure you're the best you can be on that day, really. And the programme went amazingly well, really. All of the units found delegates. They mentored their delegates. As I said, the webinars went well. And the other thing we did that was a little bit innovative is that previously you'd have to apply for a course somewhere around the country, and it could take a while for you to actually get on that course. But Karen and HEE and Bowel Cancer Screening worked with the JAG to actually set up customised assessment courses delivered at the Liverpool University Hospitals Trust. So we had some at the Royal and some at the Aintree site, so that people didn't need to go to Sheffield or London to do this, really. And the results are that I think so far we've had 11 successes out of 14 people who've applied, and we're putting on a day late in September to try and get those 3 that unfortunately didn't pass, get them to pass second time around, really. But 11 out of 14 is fantastic. It's much higher than the average pass rate. And as well as doing that, we also managed to train up some of our experienced screeners to actually be assessors, so again to be a resource for the country, so that we can now do accreditation days running out of Liverpool and Cheshire and Merseyside.